Hello and welcome to another episode of the Live the Way series. Today we invite Karthik Krishnan. Karthik is a versatile Ayurveda physician from Kerala with great experience at IP management of chronic illnesses. He also teaches at Kerala Ayurveda Academy USA and practices in India. He specialized in diabetes care through low calorie food applying principles of Ayurveda. So without further ado, Dr. Karthik, thank you so much for accepting my invitation. It's great to have you here.
Namaste, Ricardo. Thank you very much. It's been a pleasure to join with you.
Great. So my first question would be, how did you end up being a specialist in diabetes care? How was that journey?
That goes back to a few years. I was practicing at Kerala at that time, and the place where I was practicing, the Kerala Ayurveda Hospital, which is in Cochin, used to have a diabetes clinic, which was running for the past 25 years. And the helm of this clinic was managed by many versatile Ayurveda doctors, including Dr. Rajagopal, Dr. Rajnivesh. So when I took charge of that hospital, I found that many of the yogis which we were treating were having good progress with diabetes. They were healing, they were having good control of their blood sugar levels. But after a while, when they just stop the medicine or when they do a bit lax out of the diet, we seem that the diabetes always strikes back. So that exactly is not healing, right? So we find it very difficult to actually help people with that kind of a pattern. So we had a team of doctors right there, and we tried to understand what would be a good approach towards treating diabetes using Ayurveda and how we can incorporate the modern research to our good use. So that is what actually led to creating a protocol which works for diabetes, including modern research findings and correlating that with Ayurveda principles. And we found that both are very complementary, and Ayurveda has actually advocated certain results which were found through modern research much early. So that actually helped us doing that. For example, if you look at it, modern medicine only categorized diabetes as a lifestyle disorder a few centuries back. Whereas if you look at Sushruta Samhita or a Charaka Samhita, which is from a 2nd century BC or a 4th century AD, already categorized diabetes as more like a lifestyle disorders. So even if you look at the causes of the diabetes, which are mentioned in these treatises, which are very old, are certain kind of food, digestion issues, which leads to kapha dosha vitiation, as we call in Ayurveda, leading to a metabolic illness. So this knowledge, which we are actually said in these treatises, actually helped us to make a protocol which works well with diabetes of today. So that is what actually led to the diabetes specialty.
That's great. So just before we dive into the specific aspect of the diabetes, overall, we're looking at modern medicine and Ayurveda. They look at the same object, but they have different languages and different ways to look at it. So how do you make this correlation in a safe sense, in a proactive sense, not necessarily about diabetes, overall, when you do this language? What is the care that we need to have to make that proper correlation?
Okay. So the way the ancient scientists of Ayurveda looked at every illness might be very different from the way right now we are looking at any illness. Okay. Their way of classification, their way of perception and understanding could be very different. And that is true in case of prameha too, which is correlated to diabetes of the modern day. So prameha, if you look at it as the name suggests, praharshena mehati, it was considered as a urinary disease, okay, a disease where your urinary system is affected. But by extrapolation, by extension, it actually covers much more higher of a system. In the Ayurveda, if it goes to digestion, it involves the Agni, it involves everything which function as a part of Agni. So that correlation may not do justice right now with what we know as diabetes today. So I would say correlating prameha and diabetes loosely might make sense, but if we go to more and more specific, these are different stages of the disease as such, what you see in prameha. If you look at Ayurvedic classification, the are 20 types of prameha. There is 10 kapha type prameha, there is 6 pitta type prameha, there is 4 vata type prameha. So all these 20 types of prameha might be very different from what we know as diabetes mellitus today or diabetes insipidus. So it won't do much justice if we correlate directly. What we need is an attention to detail and go in deep and specifically to assess a rogi to understand what are the symptoms and what would they actually correlate to. So often it is very difficult if you go ahead and with the perception and a bias in your mind that this is just diabetes. One great thing which you can do to make an accurate diagnosis is to remove that bias and go with a fresh mind with just Ayurveda in mind to do the diagnosis, so we can idea of what are the symptoms and what do they correlate, so that you can get the right treatment protocol. It is nothing wrong to actually understand it as diabetes and to have certain idea of the pathology which is going on. But if you are looking at an Ayurveda treatment protocol to be made, following an Ayurveda diagnosis is the best thing you can do to help.
Sounds good. So I was just looking at the World Health Organization numbers, and from the number of people with diabetes rose from 108 million to 422 million in 34 years, and this is data from 2014. In 2016, there's an estimated 1.6 million deaths were directly caused by diabetes, and they estimated that in 2016 was the 7th leading cause of death. And from a different source, there is an estimate of 352 million people are pre-diabetic. So we're looking at the pathology that is really big in the scale of the world population. So could you speak about like what's happening in the body, what's going on so that we reach this stage of diabetes?
Yeah, if you look at the past few years, the number of direct death which has been attributed towards diabetes is actually increasing. Okay, diabetes is causing amputation. Diabetes is a major reason for blindness, cardiovascular accidents, including stroke. It is one of the major factors which is contributing to deaths, medically speaking. So what is actually happening? If you look at the pathology from an Ayurveda perspective, you are eating food and leading a lifestyle, having drinks which is not very wholesome, which leads to a kapha vitiation, which involves the meatus, the fat tissue, the mamsa, which is the muscle tissues, and the udaka, the liquid part of the body, including lymph, the liquid part of the blood, and all these are affected, leading to what we call as a metabolic syndrome called as prameha, right? If you look at on a modern perspective, it's more like there are two types of diabetes insipidus and diabetes mellitus. I think the topic more relevant today is diabetes mellitus, which is the most common one. This is where your body is not responding to the insulin, and after a while, it even stops producing insulin. Now, why insulin is important? If you have to convert the glucose in your blood into a usable form inside the muscles, you need insulin. So insulin works as a key. You can understand this like a key and door mechanism. If the glucose has to enter your muscle tissues, insulin works as a key to open the door for it. But what happens if the key is not or the lock is not responding to the key? So what first happens is your glucose cannot enter these muscle tissues. They remain in the blood, right? Leading to a lot of illnesses, a lot of reactions in the body, including many inflammations, including cardiovascular accidents, including high glucose level, which is the major detectable feature through a lab test in diabetes. So all these can happen when insulin is not responding, or the body is not responding to the insulin the way it should be. After a while, what could happen is that even the insulin production can even go down in the body. So this is the major pathology if you look at from an even Ayurveda perspective or from a modern perspective, which is happening in the body. So essentially, it is like your body is not able to utilize certain nutrients for energy, in this case, which is glucose. This is what is happening.
Yeah.
So why that is not happening, if you look at it, it's actually a glitch in the metabolic system. So metabolism, as we know, is not just in the stomach. It is happening all over the body. Digestion, respiration is a process which happens at gross level and subtle levels. According to Ayurveda, across every cell in our body, every tissue in our body, what we call as dhatus in Ayurveda. So it is happening at all levels, at the gross level as the subtle levels. So when this metabolic activities slow down or there is a glitch, it creates a certain kind of thing which we call as armor, which is like kind of toxins which doesn't work. In this case, you can see that the glucose in the blood is underutilized, that they remain as an armor, they remain as a toxin. So which was supposed to be a nutrient is actually harming our body. So this is what is happening in essence.
So, and I guess when you work at your medical practice, a lot of people already come with a diagnosis of diabetes. So, do you do any other type of diagnosis to, assess the line of intervention? How does it work? Do you mix the both things?
So if you look at it right now, even certain yogis find about diabetes even without any symptoms. They might do a regular blood diagnostic test and they find out they have high blood sugar. The symptoms might not have even occurred. Okay, so the major question there would be, should you call it as a prameha? For example, to call it as a prameha, you need to have certain symptomatic or symptoms which actually tells you this is prameha. So if there is no frequent urination, if there is no other problem, but if there is a blood sugar, say somewhere close to 130 mg per dl, where the normal should be 110, would you still call it as prameha? So that's, I think, it's a valid question. That is one of the questions we as a medical team, when we are at Kerala Ayurveda, tried to solve. So what we came up with was like, all the prameha symptoms, when they appear, they could be correlated to the madhumeha, which is a Varja type of prameha, which is very similar to diabetes mellitus symptoms. But if the blood sugar is somewhere much more less and there are no symptoms very visible, or there are very subtle symptoms like a bit of tiredness and that's all, nothing else, how would you understand those symptoms at that level and do the diagnosis? So we tried treating that as a dhatu gata ama or dhatu agni mandya, where the metabolism of at the dhatu level is impaired, and use medicines to treat that, and got very good response. For example, there are certain medications in Ayurveda which would work effectively when the diabetes is even at advanced state, or at the state of diabetic ketoacidosis, like Kathakagathiradi Nishakathakadi, etc. But what we have seen is, if we apply the principle of Dhatu Agni Mantya and Ama at the stage of an illness where the proper symptoms are not even completely manifested, it gives much more better results. So we look at symptom complexes, we look at blood tests for sure, and we also look at how the patient is and what are his current lifestyle, so that we understand what phase he is at. So we do lifestyle corrections, and basically, which the most important one would be the diet. So this is how we diagnose and go to understand a proper goal in a diabetes.
So you already mentioned that, but when we're talking about diabetes mellitus, we're talking about basically food and lifestyle as the primary cause of the imbalances.
Yeah, I think this is one of the area which is quite neglected or overlooked in Ayurveda as well regarding the diet and diabetes. There are certain peculiar features about lifestyle and diet which is mentioned in the treatises of diabetes. If you look the general approach of Ayurveda towards, let's start with exercise. Ayurveda always says don't overdo your exercise. Usually only do half of your strength. Not more than half of your strength should be expended for doing exercise. But in diabetes, the sense is entirely different. So the Acharyas goes on saying, do heavy exercise. Heavy exercise like walking with a herd of cows for the whole day, or even dig your own pond. Can you believe that? Dig your own pond. So such hard, heavy exercises are mentioned. Why is that? Even if you look at the diet, where the Acharyas have strictly said, go for apatarpana in specific. Even Charaka goes ahead and says something which is very peculiar called as Guru Apatarpana, which you cannot find in any other disease. The Guru Apatarpana is where the food you feel as heavy, which actually satiates your hunger, but does apatarpana in the body. Now, that might sound like a bit contradictory in the first glance, because Guru, in the sense in Ayurveda, means something which is heavy. It's supposed to be nourishing, it's supposed to make you heavy. Whereas apatarpana is a protocol of lekhana, where it's a reductionistic approach, where you actually bring lightness to the body. So how a substance can actually do both. So the idea is giving food which feels heavy, so that your hunger could be managed, but does lengthen to the body. So these are much peculiar aspects of diet and lifestyle in diabetes, which you cannot find in any other illness. So how to apply that to the modern world? See, one thing is to understand why these principles are said. If you look at it, we understood the role of fat in diabetes very lately. Okay, the fat metabolism is very much linked with diabetes, and we haven't had given much attention to this relationship. So until 2015 or so, the modern medicine even considered diabetes mellitus as a progressive disease. Even if you go to Google and do a search, what it would say is that diabetes is a progressive disease and that it doesn't have a cure for diabetes group of diseases. What changed in 2015 is there started researchers which started coming out saying diabetes could be cured. How? Because we thought, or the modern science as such thought, the pancreatic beta cells which produce insulin are dead in diabetes. When you get diabetes, what happens is these cells deteriorate. Okay, they lost their functions, even they lost their structure, so they just die, is what we thought. Okay, they're disintegrated is what we understood. But new theories started popping up around 2015, which says that no, they are not dead. These cells are just sleeping. Okay, they are just in a dormant state, and you can reactivate these cells so that you can actually improve the production of insulin. Now, how to reactivate these cells? So what they proposed, the researchers proposed, is that if you actually reduce the fat around the pancreas, essentially if you reduce your waste fat, it will actually re-energize these cells to produce more insulin. Now, why this is very interesting to us in Ayurveda is because the diet which is said in Ayurveda is exactly this. The diet which is not contributing to fat, and an exercise regime which is evidently looking at reducing your body fat. Okay, which makes a lot of sense, which even though comes centuries back, this new researchers actually validate what has been said in Ayurveda. Now, this is also relevant if you even look at it from a modern perspective. Why? Because if you reduce your fat, the insulin sensitivity of the body increases. So if you have more, like if you're obese, if you have more fat in your body, the sensitivity of the body towards insulin is less. So even a small amount of insulin cannot work. But if you are not fat, if you're much more leaner, if you can cut out the fat, even a small amount of insulin can work much better in your body. So how you manage your fat in diabetes can actually have a say at how you reverse it. Now, after 2015, we have seen a lot of studies where they have claimed that diabetes is reversible. Now, that I agree is a controversial topic, of course, but there are a lot of research backing to that. And at Kerala Ayurveda Hospital at Kochi, we have even had instances where people were able to reverse their diabetes, get out from their medications, and live a normal life without having any complications or issues of diabetes. So how is that possible? How does that work? Is through the diet, basically. You need medications to help you, but diet plays an important role. So if you're able to follow a diet which is devoid of any fat, which is essentially Guru Apatarpana, but can manage your hunger, can satiate you and keep you happy, and if you're able to reduce that fat around your waistline, do essential exercises, your insulin production will actually increase and your insulin sensitivity of the body will actually increase, effectively reversing the diabetes. This is actually done so that you can actually withdraw the medicine slowly in a timed fashion. So this is possible. So this part of the diet is not much known, how to put it, to the common public, but I think this is getting popular. For example, if you look at researchers, there's Dr. Roy Taylor who actually proposed this at the Banting Memorial Lecture in 2015, if I remember right, in UK, who said that diabetes could be reversible with a very low calorie, high fiber diet. So what he proposed was a juice diet where the subjects undergo just on a juice diet and reduce their blood sugar level, but improve their insulin production and improve their insulin sensitivity. I think in 2016, he did a study and actually proved his theories. So a lot of such diets are coming up. So what we follow in Ayurveda, or in general, as I follow it, is a low calorie, high fiber diet. Now, why a low calorie, high fiber diet? So if you look at Guru Apatarpana, the principle is that you have enough food to make your tummy fill. So why this is, see, it is also about our psychology, how we understand food as a dravya. Okay, food is not just something which is just physical and just fills your stomach. It has to fill your heart too, as people say. So to us, to all humans, food is more than just a substance which fills your stomach. If you remember from your childhood, maybe your father or mother might be feeding you, or you go to a feast, you feel happy. So over time, we associate food with happiness. So you might have seen this trend with people who are depressed, people who are very sad might develop an eating disorder. Why? Because they need contentment, they need fulfillment, they tend to eat more. Okay, whereas there are certain people who will actually deny food. They won't need, I don't need happiness, I don't need food at all. Right, so it's not that food they are just denying, they are also denying happiness. They are also trying to check out happiness from their life, or they're trying to eat more and bring that feeling of, that sense of fulfillment. So in diabetes, what happens, or in prameha, what happens is you have increased hunger. You always feel hungry because you're energy deprived, right? So the natural response is to feel hunger all the time. So you need to actually then fulfill this hunger to keep the rogi okay, the patient satiated, but what you're eating should not contribute to calories. So how would you do that? So the only sensible solution would be fibers. Okay, dietary fibers, even like in vegetables or in any other substances, does not contribute any calories in essence to our body. It just goes just right out and actually fills our stomach. Okay, so it can fill our stomach, it can make us feel satiated, but does not contribute anything to the calories. So I thought this would be a right way to go ahead. So there are a lot of researches which is happening all over the world, which actually help to move towards these kind of low calorie, high fiber diet. One of an example from my state in Kerala is by I would put technocrat turned scientist called James Joseph, who actually started using jackfruit fibers as a diet for diabetes, to promote it. So what happens is these fibers are very low on calorie, high fiber, flour, which actually fills your stomach. When you make anything out of it, you can make anything out of it, but it does not contribute any calories. So essentially you are eating some just fibers and you're not contributing to the blood sugar. So that essentially will do the thing which we just said ahead, which is like it reduces the calorie, it increases the fiber, increases satiation, so that it is doing a guru apatarpana. It fills your stomach, but it's not contributing any. So that exactly follows the guru apatarpana in Ayurveda as a principle. So with that diet and Ayurvedic medication and having good exercises, we have been also able to to help a lot of people with diabetes, and have proven much more effective than conventional ways of treating diabetes. So if you look at the conventional ways, it is just giving a medicine to lower blood glucose level, but that doesn't solve anything. So this approach has actually enabled people to take charge, take control of their prameha, and even offer a chance to reverse it.
That's amazing. So, but this, when we're talking about treatment and management, these ideas that you give, would this only be done in a treatment setting, or it's something that the person who had suffered from diabetes, even if it's reversed or managed, would have to continue for a long term?
See, if you look at the term treatment, with chikitsa in Ayurveda, treatment actually involves food, lifestyle changes, and medicine. Okay, you need to change all these things to make the treatment effective. Treatment is not just popping a pill. Okay, the rogi and the physician, or the patient and the doctor, has equal responsibility inside it. If the question is more on whether somebody can follow outside of a treatment setting, yes, definitely. But I would suggest that you need to make your doctor aware that you're following this kind of a diet. Why? Because when you follow a low calorie, high fiber diet, the fluctuations in your blood sugar level could be very drastic. So you might need to adjust your dose of medicines if you're taking any of those modern medicines which lower blood sugar. So a very low blood sugar could be very fatal. You can go unconscious, you can get into a shock. So you have to make sure that your blood sugar medicine dosage is controlled accurate. So if that is done, anybody can follow a diet. So it's just food that you're engaging with. You're not taking any medicines. But let me tell you, a low calorie, high fiber diet is one of the best approach, if you look at it, than a medicine to treat prameha/diabetes.
That's amazing. So, but we're talking about diabetes type 1, diabetes type 2. This is only more focused on diabetes type 2, or would it also be applied for the other types of diabetes?
So if you look at reversibility as a factor, we are talking about diabetes type 2. Diabetes type 1 is where there is no capability for the body to produce insulin. So the key is not there to start with. In type 2, there is the key, but it's just broken, or the key is not just working. So it is much more applicable in type 2, but to control your diabetes in type 1, your blood sugar level in type 1, the same diet approach can be taken. But the chance of cure might be much more less. As we say in Ayurveda, it is a sahajam. I mean, it starts with your birth. So such kind of illnesses are very difficult to treat, and the prognosis is not that great in terms of results. So yeah, I'm talking more on diabetes mellitus here.
Okay. So there's this idea that the classical diabetes from Western medicine, it's one of the last stages of prameha, if I'm not mistaken. So what would be some keys, ideas, symptoms that we should be attentive to according to Ayurveda to let us know that we're in that direction?
So if you look at it, the name itself suggests that frequent urination is one of the common symptoms. Increased thirst is another symptom. Increased hunger, appetite, is another one. Other than this, you can see fatigue. And as diabetes progresses, you will see a lot of complication, including diabetes neuropathy, retinopathy, and whatnot. It goes all over the way. It can contribute to cardiovascular illnesses as well. But there are symptoms which are very easy to overlook. For example, fatigue is one of the early symptoms of diabetes, which many physicians overlook, or even many yogis leave doctors just patients. And they just consider fatigue as like maybe from the work or as a part of the normal day. They don't understand that as it as a symptom of diabetes. So I would suggest one way to look at this would be to do regular tests so that you would understand. But you need to understand also that having a variation in your blood sugar level by a few units, it's not actually prameha in Ayurveda. It may fall into diabetes category according to the modern medicine or borderline diabetic, but that is not prameha according to Ayurveda. For prameha to be diagnosed, you need to have this excess urination or a urinary issue coupled with the appetite and the thirst issue to happen. So when all these symptom complexes come together is what we diagnose it as prameha and can apply the protocol. So until then, that protocol may be like an overkill. You won't need it, or that wouldn't fit for the actual pathology which is developing. So the pathology is more at a prodromal stage. So you need a different approach altogether to treat that stage. So a healthy way to look at this would be to have blood tests on a regular basis, like 7 months and 6 months or so. But you don't need to be worried, saying that okay, you're going diabetic or you're going to prameha, because variation is quite common. Our body is not a machine to keep up the optimal level all the time. It will vary here and there, but that is completely okay. So that is another thing which we need to keep in mind.
So it looks like as usual, the Ayurvedic approach is a very holistic approach to development of a disease that looks also at various aspects of our life. So dealing with diabetes through Ayurveda, is there anything else that we didn't mention so far that you would think it would be important to look at?
So exercise, as I said, is a major part. So you need to have proper exercises, but you shouldn't actually overdo it as well. So I told you already that Ayurveda says diabetes is one of the illnesses where you can do heavy exercises. But even then, you need to be mindful about the condition of your heart, your other systems of your body, so that you engage in a wholesome exercise. So that is very important. But that being said, diabetes is an illness which demands high level of physical engagement. Okay, I'm not saying that you go out and do a high intensity training every day, but something which is regular and which is building which goes consistent would actually help much more than a very fast workout, which is only once a week or so. So you need to be consistent about it. You need to keep up the circulation. You need to keep up the body cells engaged. So that is one thing which we look at. So just medicine, popping a pill is not going to resolve any diabetes, believe me, or prameha for that matter in Ayurveda. This need to be understood like a combined approach of the diet, of the exercise, and the lifestyle, and then of course the medicines. So that approach is much more important than anything else when we come to treating prameha.
And if we look at in the case of prevention, okay, so what can we do? What should we do to make sure that we're not going to become part of that statistic? Even the prediabetes numbers are huge. So how can we make sure that we stay? We already touched about it, but what can we do?
Yeah. So if you look at another principle, it says nidana parivarjanam eva chikitsa. Even removing the causative factor itself is treatment. So that actually applies to prevention too. So you can actually reduce food and activities which increases the buildup of caffeine in the body. So basically sweets, food with high fat, especially trans fats, should be avoided or should be reduced, and follow a balanced diet is much more important. Then the second thing would be to have a healthy lifestyle with adequate physical movements. Right? A sedentary lifestyle is not going to help. So you need to have physical engagement for sure. You need to have enough rest in your life. So there is this concept of the tripod of health or life in Ayurveda, which covers ahara, nidra, and brahmacharya. These are like three pillars: the food, the sleep, and the lifestyle, which works as three pillars of your health. It's like a camera tripod. Instead of a camera on the top of a tripod, it's your life sitting on top of it. If any of this leg is not stable, if they are not balanced, the tripod would fall. So the life assets would fall. So the ahara, if you talk about the ahara, as I said, it should be at the right amount, the right time, with enough of all the taste and a balanced one. So that is ahara. Nidra, your body needs rest. High amount of stress, anxiety are actually not doing much help to diabetes. Let me tell you why. For example, there is this fight or flight response in our body, controlled by our autonomous nervous system. What it does is when we sense a threat, okay, when we sense fear, it creates a fight or flight response, pumping more blood sugar to the muscles, because your muscles need more energy. So the sugar concentration on your blood increases. So when you're always stressed, when you're always anxious, when there is always a deadline, you always keep yourself on a high alert, so that your body always have high blood glucose levels. So that's not helping your body in any way. So you need to have enough rest, sleep, peace time, your own time, so that you can recoup, regenerate, and align yourself. So sleep is also one of the important. When I say sleep, I'm also touching of aspects where you get your own time to have your own space to reconnect with you. The third aspect is brahmacharya. Now, brahmacharya is not as abstinence from sex or anything like it is understood in certain cases. In this situation, it is more to be understood like a lifestyle. If you have an active, healthy lifestyle, good relationships, healthy engagement with the society, that would actually help you to keep you positive and less stressed, which will actually in turn contribute to good health. So a lot of people would ask me during my consult, is there any formula to remain healthy? I would say to create a formula for being healthy is difficult. This is the one which comes very close. Ahara, Nidra, Brahmacharya. If you take care of your food habits, when to eat, what to eat, how to eat, and you take care of your sleep, you take care of your regime, you take care of the time for yourself, and you control your life activities, I think these three together can actually improve the quality of life, prevent not just diabetes, any illnesses from happening to you.
That's great. So there's a lot of, sometimes we don't speak about much our emotional side and our mind, the state of our mind. So do you really think that's also one causative factor in, let's say, in the case of diabetes?
It is, not just in the diabetes, but also in variety of illnesses. As I said, I told you about the system where stress can create a high blood sugar level in our human body, it can also contribute to, let's say, high heart rate as well. So you know that our heart rate is controlled by an electric system called as the SA node, which are cells which excite the heart so that the heart goes on beating. So this SA node is again controlled by the autonomic nervous system. So think of it, when you have an emotion, that emotion is going to stimulate this autonomic nervous system, causing your heart to actually beat more or less. If it is the sympathetic system which is getting stimulated, it actually increases the heart rate, okay, making you more restless, making you always on high alert. Whereas the parasympathetic system, which actually reduces your heart rate. For example, when you meditate, when you sleep, when you are calm, peaceful, it is the parasympathetic system that gets activated and you feel much more calmer and healthy in the body. Whereas when you're on alert, when you're stressed, when you're anxious, when you're facing a threat, it's the sympathetic system which gets activated, which increases the heartbeat. So in cases where, if you can see, coronary artery diseases, when you are on a high stress, the heart disease actually goes on to a peak stage, and even you get a heart attack because your heart demands more and you're not able to give it because there is a block or something. So that results in a heart attack, heart failure, etc. So that's how emotions directly contribute towards illnesses, be it diabetes or be it cardiovascular accidents. So it has a great saying in it. We don't acknowledge as a society about, or we don't give much perspective to this, to even our children, to even our family, about having emotional stability and to have good connections. If you look at it, what I understand from experience is one of the basic aspects of the health is to have good relationships with each other and with the society. That actually goes a long way. The peace of mind, the ability to actually engage with each other, to understand, to listen, and to have compassion is actually much more important than you understand algebra or trigonometry or anything, because this is one of the life skills which you need to develop and can go a long way in helping you to have a good health.
Perfect. So going forward, do you think that dealing with diabetes, that the combination of the knowledge of Ayurveda with modern science, is that combination going to be more fruitful in the future? Is going to be more hope for patients? What's your opinion on that?
I think, see, the conventional way of treating diabetes is changing all over the world. It's not just with Ayurveda, but I think Ayurveda principles can definitely contribute to this. Ayurveda is already making a lot of progress in reversing diabetes, in treating diabetes much better than any other system of medicine. That being said, I think an integrated approach can go a long way in treating diabetes. Okay, so which includes a diet plan, which includes an exercise plan, which includes medicines which are bespoke to the yogis, can actually do much more than just popping a pill from time to time and controlling just blood sugar levels. So you need to understand, just managing blood sugar level is not treating diabetes. So the way which I rather look at it is more wholesome. Can we actually turn around this pathology? Can we actually break this pathology and can bring back a person who is diabetic or prameha rogi into health? Is a key question. So what I believe is, yes, the Ayurvedic principles can definitely do that, and we can benefit as we go ahead to when more researchers come out and we have better validation for the principles in Ayurveda. So yes, I do think that this is exciting times for treatment for diabetes.
That's promising. So we spoke about the diabetes through Ayurveda. Was there something that you thought we didn't touch upon that you think would be important on the theme?
I think we covered pretty much, yes.
So we're going towards the end of the interview. I would like to ask you if 3 main tips for every person to do to maintain a healthy life. What would be your three tips for these people?
So the first one would be, like I said, the tripod of life, the ahara mudra brahmacharya. You look after the way you eat food, You look after the sleep, your own time. You need to have your time to reconnect with yourself. A long time, what do you call it? It might be the time you do yoga. It might be the time you spend for your relationships. But whatever it is, you need to have that time for yourself. The third thing, as I said, is life activities, including engagement with the society, including exercises which you do. The daily things which you do can have more impact on diabetes than once in a week stuff. For example, if you create a habit of walking every day, if you create a habit of swimming every day, that can help much more with diabetes than just doing something once in a week or so. So that will actually help. So creating a great lifestyle, time to engage with yourself, with your family, with the society, and reconnect to yourself, and also a good food habit. I mean, that would be the three things which, if you look out for, can actually help you stop diabetes from happening. And even if you have diabetes, this is something which is going to help you come back to the track.
That was great tips. Dr. Karthik, if people want to get in touch with you, they want to know more about what you're doing, how can they reach you?
They can reach me through my email, which I can share it with you, of course. It's drkarthikkrishnan at gmail.com. So I'll be happy to help.
Dr. Karthik, thank you so much for taking the time. It was great, so much useful information. So maybe I can have you back for another topic we can discuss a bit more.
It's always a pleasure, Ricardo. Thank you.
Thank you. So that was it, our episode today with Dr. Karthik talking about Ayurveda and diabetes. So hope to see you in the next episode. Wish you good health. See you on the way.